acne, on scars, on pigmentation. We're going to showcase this patient's result. I'm going to wait for a few moments for everybody to join me from the multiple streaming platforms that are on. But for our purposes, I just want to kind of just introduce myself a little bit and then just really go through this case, which is a really great case actually for people to really see just the process overall. This is over the course of several months, the significant improvement in his skin, really remarkable improvement. You know, he's a younger patient of Puerto Rican descent, and you can see that significant improvement of his skin. So I want to showcase that for you guys because it's really nice to be able to see just the process. You sort of see sometimes like more of the progress ones that I have. You know, a lot of them are in between sessions, but this patient, he did do 2 bigger sessions at one point, and you could see he also did some more volume too. So basically a lot with collagen products like I did actually Radiesse for him. I also did Bellafill for him to really get more volume because there was a lot of volume destruction in his case. And I also had to do what's called a fully ablative CO2. I don't always do fully ablative CO2, but in his case, you could see really thick scars initially. So I had to do fully ablative CO2. I also did something called tailor Liberator subcision, where I went inside the skin and broke up the scars. I had to use basically blades to do that really well. And really break up that scar tissue. Really thick scars. You know, men in general, a lot of times they do have thicker scars. And a lot of times it's just oily skin, thick skin. And when I'm working on the scars, a lot of times just a blunt cannula is not really going to cut it for us. Cut it literally. Really, those tethered bonds are really stuck and really thick. So that's why I wanted to showcase. This is more of that complete result really for this patient. And I saw him recently. I've actually been working on him for almost 5 years now, I want to say, about 5 years. And so you could see as he came in more recently, just the really significant improvement over here. So for him, we did what's called tailor Liberator subcision, TCA Cross. I did fully ablative CO2 laser. I also, through the laser channel holes, put a dilute form. In his case, I put Radiesse through there. And then I also injected some Bellafill as well as Radiesse. And then I did another session with him as well. Did more of the CO2 laser, more Bellafill, more TCA Cross. Worked incredibly well for him. So like I said, this is more of that complete journey for him. Really beautiful result. Really, you know, his scars were very thick, very severe scars. So it's really nice to have this. Hi Tiffany, how's it going? Awesome. I look forward. When are you coming in for your procedure? Cal Ray is saying, can CO2 laser be done for people with melasma on Asian skin? Good question, really good question. Melasma areas, I probably would avoid the CO2 laser, but I would potentially do like an erbium laser, which has a little bit less heat, and cool it while we're doing the procedure. You know, it depends on how extensive the melasma is, if there's areas that we could avoid with the scars. Sometimes I don't necessarily have to do a laser. You know, it's not about the laser. Sometimes, you know, some patients, I showed you some results last week too of some people that I didn't even touch it, use a laser on them because the skin type or where the scars were. Sometimes you don't necessarily have to do a laser. So if I'm recommending a laser, there's a real reason why. I'm trying to achieve it. Like for this patient, for example, if you look at, hopefully you could appreciate that with this photo, but his scars are very thick, extremely thick scars. So you know, we had to do a fully ablative. Yes, awesome. Yeah, Tiffany. Yeah, congratulations, by the way, on the pregnancy. I think you said November time your baby's due, right? So that's gonna be cute, and we'll take care of you later on. Miriam is saying, how much can one session of just TCA help very shallow ice pick scars? It would probably need 1 to 2 sessions, honestly. I wouldn't say just one session really by itself. How many times did he do procedures? So he did 2 fuller combination sessions. Then we also did some more Bellafill for him, and then some dilute Radiesse for him as well. So I had to do a lot of things for volume loss. He had a lot of volume destruction. And one of the things with him, he's a young gentleman, really young, and his scars destroyed not just his skin, but also a lot of his fat. And so I had to really give him a little bit of volume, and he didn't have much volume at all. He's somebody who's relatively skinny. So, you know, for him, we had to do a lot more with volume with Bellafill and Radiesse. Those are the things that we usually did. Renata saying, how much do you charge for subcision and fat grafting together? It's tough for me to say offhand. I think our prices are on our page. I think that's probably going to run about close to like 7,000 or so, around that much. How long does a filler last? So the Radiesse is going to last you about 2 years. Bellafill, 20% of it's going to continue to stay there and continue to make collagen. So that's a little bit, that's a different process because it has something called PMMA, and the PMMA is always going to stay there to continue to make collagen. Let's see here. So are combo treatment options optional? So it's a good question, honestly. So I think that I just want to clarify a few things. But really, I know a lot of people, vast majority of my patients who come to us, they really do trust the process. They understand how I do things. They know what they want to do to be able to achieve results like this. First of all, just you're coming to me, trust me. I've showed enough process over here. I've talked to you guys enough. I expect the one thing I would ask is just trust me and trust the process that I'm trying to put you through, and follow my steps and follow my advice. I don't do things that are unnecessary. Anybody who does consultations with me knows I don't sit there and sell packages. Don't try to upsell you. I will just tell you, sometimes people say, can I do this? Can I add this? Can I do that? I say, no, it's not going to help you too much. It's not something I would really recommend right now. We could take a look later, things like that. And you may just be happy with what we do enough and you don't have to do much more and it'll save you some money. And that's really how I do things. I really want to have us that we have that kind of relationship and be really clear with that. That being said, I think we have some patients who do try to pick and choose some treatments. I will tell you if it's okay to pick and choose some things, but really, for example, for this patient, I had to do all this together to optimize the results. I had to do it. There's just no other way around it. And so he's coming to me. He wants the best possible results. He wants something that's going to really maximize his results. And so we were able to achieve that for him. But we had to do everything together. Really, we had to really break up the scar tissue. We had to do the ablative CO2 laser. We had to do the collagen. We had to do all those things together. TCA Cross. And so you're never going to be able to achieve that. And someone was asking, can you achieve these results with microneedling? Honestly, this patient actually had done multiple sessions of microneedling, did nothing for his scars. You could do 100 times microneedling. It's still not going to achieve these kind of results for scars. Just absolutely, it's not going to do that. I don't think anyone would be able to say that it does. Isabel saying, I still have redness from CO2 9 months ago. Is there a thing to fix it while pregnant? You could do azelaic acid while pregnant. 10% azelaic acid is okay. Where are we located? We're over in Newport Beach, California. So I'd recommend that. Carlos saying, I just saw the phenol peels only in the cheeks. That's possible. I really wouldn't recommend that. Would do more of the full face. Really make sure it's blended in. There's no lines of demarcation. Parker saying, I had a derm recommend microneedling for minor atrophic scars. Do you recommend a derma stamp? Maybe that can heal them. Is 3 to 4 years too mature of scars? Well, a few questions there. Basically, Parker's asking about microneedling for minor atrophic scars. Maybe okay for minor atrophic scars. He's asking about a derma stamp. Derma stamp is typically better than anything with rolling, so I think that's better for that in general. Stamps are usually a little bit better. I don't know if it's going to help too much, to be honest with you. It depends on how minor your atrophic scars are. It may be better, but it is better than doing a lot of devices. I do think like Banish is nice because it stamps instead of does the rolling process. So I like the fact that they do that. Rice by Baby White saying, can Bellafill be dissolved just in case it goes south? It's not really that it dissolves, but really the collagen around Bellafill, you can reduce that if there's a little bit too much Bellafill around there. Renata saying that she trusts me. You are very dedicated for acne scars. I was inclined for Dr. Davin Lim, but you were super good, I think. Thank you. I appreciate that. And, he's very good too. So I like that there are options for people. I do want people just to be able to see who they feel most comfortable with. And just, in general, I want people just to really feel like they're going to get the best possible results with me. That's what I care about. I want everybody to just have this open process and open forum and really feel like, their questions were answered, and nobody feels like they didn't really get the full complete picture. I've shown you people the process. I've showed you what to expect after a single event, after a single session. Now you have somebody who's more of a complete result. He still actually wants to feel a little bit more. Actually, it's sort of like almost never complete for some people, which is fine. Even for myself, I want to continuously get better and better. I want my skin quality to get better and better, and it's really fun for me. So it's someone was telling me today. I had a consultation. She said that the dermatologist that she went to said that she has to do treatments every 6 months to maintain the results, and I don't understand what that means. This patient, for example, his results have been maintained for years and years and years. You don't have to do treatments every 6 months to maintain results, but you can do it just for fun, just to make your skin quality better. That's true. We can make your skin quality better and better and better. There's no question about that, honestly. Parker saying, do you believe diet significantly reduces results, feeding your body the correct nutrients and overall health? Absolutely, I do. I really do believe that. I do think that diet is really significantly important. In general, things that also increase oil production are going to decrease your collagen. So things like, for example, milk, dairy in general. The dairy industry pushed milk on us so much, and we learned now so much of just how many hormones are shoved in there, and the fact that it just really does increase your oil production. So I really counsel people to really cut back on dairy. Even if you're not getting much acne right now, when you do scar treatments, what ends up happening is that you do get more oil production. This patient is actually an example of that. So immediately after the treatment for about a month, he did have more oil production. So we have to manage that sometimes, but that's normal because your skin's really dry, and now it's essentially you overproduce oil to overcompensate for that, and then you can get breakouts then afterwards. So that could actually happen, and so we have to pay attention to that. So, all those things are really, really critically important for us. And when we're doing these treatments, we want to pay attention then to something that triggers oil production, like dairy, for example. Maureen, awesome. Look forward to seeing you. Hopefully I said your name right, by the way, during the consult. Really look forward to seeing you, though. About Kimmy saying, how many sessions the person above had to do? So he did 2 bigger combination sessions, and then he did multiple sessions of Bellafill and dilute Radiesse. Let's see. I know I missed a bunch of questions here. Let's see here. Carlos saying, I think I answered Carlos' question. What do you do about large pores? So a lot of times large pores are really, actually, if you look at them, they actually could be ice pick scars. They're not really pores, so you could do a little bit of TCA for those. That could actually end up helping out there. Ali saying, would you recommend for deep scarring Subcision and for minor scarring Bellafill? That's actually a great option. Yeah, that you could do it that way. And then when you lift up the scars, then afterwards you could do some Bellafill there afterwards. Can I do a cure after Accutane? Yes, you could. Just depends on the gap, because we really want to make sure that we don't overly dry your skin. Awesome, Yellow. Yellow saying 2 more days. Can't wait to see you, Yellow. We look forward to seeing you. Actually, really excited. I haven't seen you in a little bit of time, so it'll be really nice. Miriam saying, what can I do to prevent any breakouts after a cure? Can I get cortisone shots to prevent more scars? You could do that. Most likely, just Miriam, I'll have you back on your tretinoin. That's probably really good. So I'll probably recommend doing that. So let's see, I think it's like period or something. It's saying, hi, doctor, can I still do microneedling even after I undergo subcision? Let's see. It depends. I'm not sure. I saw so many questions here. What brand of azelaic acid do you recommend? Paula's Choice is actually good, so you can maybe consider that. I know I missed so much here. Let me see if I can try to go back to the questions. Thanks, guys, by the way, for all the questions. I know there's a bunch here, so let me know if I missed it. Just go back and re-answer that, please. So it's really hard for me to go back to all of them. So if I missed some of your questions, you feel like it's pressing, I'll go back to it. Renata saying, actually, I'm in Canada and I need to get done with my treatment from you. So will you give me medical letters so that I can apply that along with my filing for U.S. visa? Yeah, I can help you with that. I will help you with our staff could help you with that. No problem. Parker saying, any idea how old this patient's scars were? Well, he's actually a younger gentleman. He was actually, I think at this time, he was only like young 20s, like 22, I want to say, or so. So probably not too old of scars, to be honest with you. Although I think he had it when he was like 14, 15 years old. So maybe, 6 years or so, potentially like 8 years or so, but I'm not sure. Tichan is saying, do you prescribe antibiotics during these treatments? Yes, we do. We do prescribe that just also prevent infection. And then if you get active acne, we could also prescribe some more antibiotics, either topical or oral antibiotics. Let's see here. Anita's saying, amazing result. Appreciate you, Anita. Let's see here. Hannah's saying, I have 7 big boxcar scars on my face. Is $50 per scar TCA a good price? I'm in Toronto. I guess it sounds good. I don't do it that way. I do it just basically doing a TCA cross, just like a blanket type of way. I don't do it like per scar, but sure. Medina's saying, will the Erbium laser help with large pores and symptoms associated with type 2 rosacea? Not going to help with the rosacea. It won't help with that. It actually could potentially trigger your type 2 rosacea and cause more oil production, more inflammation like that. So you may have to do like a doxycycline really potentially while you're doing that to really suppress that. But that being said, Erbium laser could help with scars. It could help with the edge of the scars, not so much with large pores, honestly. So not so helpful with that. What's dermastamp? Dermastamp is like, if you look at Banish, they stamp the skin. I like that more than like the rolling devices. I don't think it's really helpful for the vast majority of people, but this I think is, for mild scars, I think it's a good idea. Let's see here. Levid is saying, how long till I can microneedling after Accutane and currently on tretinoin cream? You could actually do that anytime then. You just go with a lower dose of your tretinoin, potentially, or you could like stop your tretinoin like 4 or 5 days before your microneedling session. So consider that. Let's see here what was done in the photo. So yeah, this was TCA Cross. This was a fully ablative CO2 laser. So really I pretty much fully ablated every aspect of his thick raised scars. Then a fractionated CO2 laser, did Erbium laser, and then we subsequently also did tailor Liberator subcision, and then through the laser channel holes I placed a dilute form of Radiesse. I did do that close to 2 times. In his case I had to do it a couple times for him, and then I also did Bellafill Radiesse injections as well. Parker is saying, is there a better technique for applying things like azelaic acid while having active acne? I create scars trying to spread sometimes. Well, you may, when you're having active acne, you probably want topical antibiotics, like Dapsone, something like that. That's probably a better option here. Do you have any treatment for oily skin? Yeah, the Cure Laser. Cure Laser works incredibly well for oily skin. That's actually like a really fun thing for oily skin, honestly. So definitely would recommend that. Zuri's saying, do you do first-time video consultations before visiting you in person? I live 5 hours away. Yeah, well, a lot of our patients, 65% of patients at this point are out of state. We'll be happy to do that. So I will, hopefully see you soon. Just go through my page and we could be able to set that up actually. Just go through Dr. Qazi website and we could set that up. Let's see here. Tichan saying, how often do you see people break out after combination scar treatment? How about a cure? Not too frequently, I should say. I wouldn't say that I see it too frequently that people break out. It does happen though sometimes, especially people who still were having acne. They may end up doing it. This particular patient, for example, he didn't want to be on Accutane, and he comes from far away, so was due to budget reasons was not able to do the Cure Laser. Also, I didn't have it when I first started treating him, so he did end up breaking out a little bit afterwards. But we ended up controlling that remotely. So I did help him with that to control his acne, ideally at some point help out his oil production a little bit more will be really, really useful. So not too frequent for people to break out, but we could handle it afterwards. Definitely want to control it as much as we can, either spironolactone, Accutane, a cure. I try to go through all those options for everybody. I want to really make sure that you have a complete picture on the best thing for yourself. Really, the goal for me is that, first of all, I want to make sure that you don't get more scarring when you have acne. Really, really critically important. That's super important for me. And second of all, I want to make sure that when we're doing the scar treatments, your oil production is under control, your scars are better controlled. Let's see here. Marie's saying, hi, Dr. Qazi. It's been a month since my procedure and I've noticed a big difference on my scars. Thank you. Be back soon for next recommended treatments. Awesome, Marie. Look forward to seeing you really, really soon. Thank you so much for coming on and saying that. Parker saying, did the young age of this patient have to do with his amazing results, or can most people expect this? I mean, I do think that people do get a faster response when they're younger. It's true. I do think that they do get a fast response, but I have had beautiful results in older patients as well. We can be able to achieve that. Sometimes it does take more work, but also it's just about like the fact that young people tend to heal a little bit faster too. So there is that involved. there's pluses and minuses on both sides. So sometimes even younger patients like him, he still had a lot of oily skin though. So that's was a bit of a barrier for him. And maybe that's why we had to do a little bit more work, each time. Let's see here. Levi just saying, did some session with the doctor's office, then got an Accutane and got more scars from that. In my next treatment, I want to book a consultation with you. Look forward to it, Levid. I'll take a look at you whenever you're ready. Is there any current research? Renata saying, is there any current research going on for acne scars, like new technology in the future? Well, I'm still waiting. I'm actually still in the process of it. I haven't given up on it. I'm still working on the vertporfin. Still waiting for my FDA waiver to do that. So I will hope to be able to do that. There's also an acne vaccine that I hope to be a site for, to be able to do as well. I have submitted it to be able to be a site for that. It's not anywhere near being able to do that just yet though. But hopefully we could do that though. That'll be actually really nice. And that's not for scars, and we're asking for scars, but that'll be hopefully help people to prevent scars. It'll work for acne and then prevent future scars. That'll be really, really exciting. So a few things kind of on the pipeline. There's always new lasers, things like that. I don't necessarily jump at every new laser that comes out there, but at some point I'll play around with some of those options just to see if there's anything that's going to be worthwhile for us to introduce. Medina saying, will the Erbium laser help with large pores and symptoms? I think I got you there. For that Erbium laser won't help so much with that. Let's see here. Is double cleansing good? Well, if you wear makeup, it's fine, but otherwise I don't really see the benefit of that. Audrey saying, what is considered young? Like less than 25, really, honestly. Sorry if people are a little bit older than that. Let's see here. Caroline is saying, is CO2 laser good for ice pick scars? Not so much, honestly. More TCA Cross is better. The rough edges of that, yeah, it'll help, but not so much for the by itself. Let's see here. Parker's asking, what are your thoughts about vertporfin? Will that likely be groundbreaking? I think it could be. It could potentially be. I hope it will be. I hope so. I hope that more people do some research that we could be able to get FDA waivers on it and then be able to push it. I really do hope that with excisions we could get scarless results. It'll be really, really exciting, really, really great for people. Some of these excisions, sometimes it's like, you do see a little bit of a linear scar afterwards. It'll be really fun if we could do that. Let's see. Renata saying, I'd love to see your research papers. If you may, I have reference from Google Scholar. I hope you have research papers. Yes, I'm actually working. I have a Subcision paper that I'm trying to get published very soon. TCA Cross paper that'll hopefully get published soon. So I have a few things actually. So we'll do that. We'll have some more papers actually soon. I'm a busy person though, so I'll try to basically do these as I go along. But like right now, I can tell you, to be honest with you, fall time is like our busiest time. Like everybody right now is trying to book. Like everybody that I should say not everybody, but a lot of people that we consulted earlier from the year had said that they wanted to do it for the fall and winter time. And so I have a lot of patients that like just back to back. And the thing with me is I pretty much limit to the amount of bigger combination sessions every day is 3. I try not to do more than that just to make sure I'm not fatigued and everything else. So I give you guys a full amount of energy. I could do definitely like more TCA Cross or Bellafill like those days, but like in terms of like Subcision, which is like more manual work, there's a lot involved with that to really, really precisely break it up, a really high concentration to really do that. So I try not to do, I should say, a lot of Subcision cases in a single day. Usually 3 is my max for that typically. That is kind of the one thing is that we try to fit into for people. We sort of have a limit. But if there's other things that we're doing that day, and it could be that we aren't necessarily doing Subcision, or fat transfer, things like that, we may just have to do like more like Bellafill. That's not really much of a problem. TCA Cross, those things, those are all fine. And then of course I see my regular filler patients and I see a Botox patients, and I do a lot with skin tightening as well. So I do all those things, and so as long as I could do that, mix it up for the fall time, I'm happy to help and fitting more patients in there if we could. My team knows that we just sort of have to like make sure that we don't overextend ourselves. It was just like really, really great. The way that we do the schedule, it's just like also a great mix for me too, just of different cases. And honestly, like everyone wonders a lot of times like how I'm doing this and things like that over and over. But it's really, really fun. Honestly, it's like every single case is different. Every single scar is really different. It's really exciting to be able to do that actually and see that and see positive change in someone's life, like this patient. See like this really, really great that confidence boost for him over time, over years, like really a lot more confidence now. It's really fun to see that. Jay's saying, how soon after subcision and laser can you start using benzoyl peroxide again? Probably slow, actually, because I don't want to overly dry your skin. Probably wouldn't do it right away at that time. Let's see here. I saw someone's question here saying, Momo saying, for mild scars, will ND-Med microneedling work, or should I opt for subcision? Well, if it's mild scars, you may just do microneedling. That's okay, but I don't know if it's going to help too much, to be honest with you. Sichuan is saying, does subcision hurt? It looks gnarly. I don't know if any patients are on right now that did subcision and want to answer Sichuan, but no, it doesn't hurt, honestly. It really is so numb, it doesn't hurt. Where can you get this done? You can get it done with me. I'm over in Newport Beach, California. I'm one of the few people in the world who does a ton of this. So yeah, take a look and see. I do a ton of this. Let's see. Carlos saying, if I do a cure only for the nose, will it be the same price? No, that's not, Carlos. You could talk to the office about that. Blackheart saying, what are the cure for big boxcar and bumpy surface? Boxcar, a lot of times Bellafill works really well. Laser around the edges, that really works really well. So usually you do that. Miriam is asking, how long should I wait till after getting TCA and a cure to start my tretinoin again? Probably about 6 weeks or so. So probably about that. Let's see here. Let's see. I know I missed your question. Carlos is saying, I finally answered the question. Sorry, Carlos. I didn't realize you were asking for so long. Sorry. I get a lot of questions, honestly, in here. Sometimes I miss it. And it's on multiple different platforms too now. So it's like, I try to still give certain things. You guys have been with me for a long time. So I do try to get to your questions, especially rapidly. If I miss it, sorry about that though. Tichin is saying, if you have mild acne, is there a chance that treatment can cause your body to produce cystic acne? I mainly have occasional whiteheads. I'm nervous about treatment triggering worse cystic acne. Well, we do want to control it better. I know that's something that we would want to do. I think with your case, azelaic acid is a good option during your pregnancy, so try to consider doing that. Ronald is saying, have you done thread lift, subcision, and Bellafill? Because I believe when I lift my skin, scars disappear. I hope you got my point. What would you say? So thread lift could stretch out the skin and improve it. I'll do some videos about it later on. I really have moved away a lot from my practice with thread lifts. I don't really love thread lifts, honestly, for the vast majority of patients. Really select patients will I do it in now. I'm somebody who deals with a lot of complications in the area. So I saw so many complications because I do so much of subcision. So people would ask me to fix their threads that were really stuck, things like that, and superficial. And it was really tough to be able to do that for people. And it was worth it. It helped out people, but I do think that thread lifts are something that maybe not be worth it for a lot of patients, honestly. Parker saying, as a 23-year-old with not a lot of money, would you recommend rushing to get treatment while I'm young and my scars are younger? Well, I definitely wouldn't say that you would have to rush it, honestly, at all. I do want to have this where you feel really comfortable and you're at the right space to be able to afford these treatments, really. I'll be really honest with you. I don't want you to go into debt for this. I know I'm going to be able to improve things. I know I'm going to be able to work at it. You have my really guarantee that I'll do that for you. I'll be here to help you through this and get you to the best possible result, really. Every patient of mine knows that I will do that there. And I will go through walls to make sure that we can get this improved for you. But that being said, that I also wanted so that you will get that, but once you feel like you're comfortable and you can afford that and you could do that. Don't feel like just because I said that you're going to have a robust collagen response at a younger age, that means that it's game over for you if you're older. Sure, it's better. I like the fact that it's newer, fresher scars a lot of times, but we still get great results. I show all the time a lot of patients in their 30s, 40s. I've even shown patients in their 60s and 70s actually on here. So I show a lot of results on here, and it's there's no question actually that we still could get great results. I don't want you to go bankrupt for these things at all. And that's also why I try to keep my prices with a certain limit. Of course, there's other ways of doing this, but I want to have it so this is as accessible as possible, really. Allison Kennedy is saying, can you do lasers on antibiotics? Yes, you could. You're just maybe more sun sensitive with certain antibiotics. So I just want to make sure you're using a lot of sunblock there. Jay is saying, if flying out of the country, how long would you recommend staying in Cali for recovery purposes? Really just about 1 day, honestly. You could go back the next day. It's no big deal. I know a bunch of things. The gentle Jules is saying she loves my work, appreciates you. Cecile is saying, do you offer training and shadowing days? I get a lot of questions about that. Honestly, I probably won't be able to do that during this fall time. It's just so busy right now. Fall, winter time is just like jam packed. It's tough because of that. But at some point, we could take a look and see about when I could do that though. We could, probably like next year or something like that. I could consider doing that though. And Blackheart, appreciate you for saying I'm the best. Appreciate you guys. I hope this stuff helps you. I hope you guys see, I really did want to have one thing, was bothering me a lot in life was that how that was causing this stuff, like scars and acne was just causing so much depression out there and so much hopelessness out there. And I really wanted it so that we have somebody that could showcase people that there is hope for this in all skin types. We can achieve things, but you do have to be in the right state of mind. You do really need to be able to have it so that you're patient with this as well. You really do need to be patient with this. Parker saying insurance needs to cover acne scar procedures. Parker, you haven't seen my other talks about this, I don't think, because you're on another platform right now. But really, I've focused a lot on that before. And honestly, it's election season, and everybody just wants to say just to vote for somebody. I don't know why you just want to just like sit there and jump around and push for a candidate. Really, you should be pushing them right now. This is the time. They're vulnerable right now. Go push it. Go push every candidate out there and demand it and spam them and tell them that they should be like insurance needs to cover this stuff. This is like, that's on them. That's on the legislative act, and push your local Congress people and do this stuff and really get it so that this stuff is pushed. And insurance does cover it. Like in California, at least, it should be covered, So talk to your local representatives, things like that. Your local representatives are very accessible, honestly. I don't know if people really realize that, honestly, really. Local politicians actually will love to talk to like their local constituents. It's really easy to do. You should talk to them. Right now, it's like your time. You have like the power to go talk to them and push them and tell them to start covering this stuff. This stuff should be covered by insurance. It 100% should be. You look at a patient like this, and this is a pathology of the skin, really. This is not really at this point a cosmetic issue. This affects so many different aspects also of people's lives that it's really just ridiculous to me that this is just considered an elective cosmetic procedure. It shouldn't be. It really shouldn't be. So push everybody right now. This is election season. Go do it. Everyone's just like, oh, vote this, vote that, and do this no matter what. It's like, who cares? Like, just let's go push things right now. It's none of this stuff matters like that. Like, just like, they're not going to listen to you afterwards. I'll tell you that. They're definitely not going to. This is the time to do it and get them to sign up for that. Miriam is saying, how far ahead should I book to see you? Well, book me now. Book me right now. Because it is booked up right now for fall winter time. I am doing more things with like a few more hours, things like that, to be able to accommodate some people certain days. So try to book now so we could be able to see you soon. Main saying, I just got lactic acid peel covered under insurance. I wonder what else is covered. That's awesome that you did. That's awesome. Momo saying, I got Radiesse injection, didn't see much improvement. How long should I wait to get Subcision treatment? Probably like a month or so. Wait for that swelling to go down. We could be able to help out with that. Let's take a look and see. I know I missed a bunch of questions though, but if I did, feel free to re-ask. I'm allowed to be finished up right now tonight. I'll be back on, tomorrow is still Thursday, right? Yes, I'll be back on tomorrow then. So I'll see you again tomorrow though. And we'll see what else we could talk about though. But I love talking to you guys. So if you feel, I do get a bunch of questions all the time. People always send me stuff. If you feel like I'm missing any questions right now, let me know too. I'll be happy to answer some things, for tomorrow. So you can message me and we can kind of go through things too, and do it for that. And by the way, you could actually go through my page, Dr. Qazi, and you could go through the forum over there and you can submit photos and things like that too. And we could take a look and put that on the live also. How many sessions does this take? This took 2 bigger combination sessions. And then we also ended up doing more Bellafill, Radiesse, things like that for him. Can you do HA filler with Bellafill and Subcision together? Maybe. We'll take a look and see. Maybe. All right, guys. I will see you guys tomorrow. I'll be back on tomorrow. If you have any more questions, let me know. Have a good one, though. Take care.